The last thing to wrap up with today for our skeletal system, tissues, bone, and cartilage lecture is diseases and problems. One of the most common problems with bone that you'll encounter will be a fracture or a break in a bone. Fractures can be classified as simple or compound depending on whether or not the bone breaks the skin. Simple is no bones penetrating the skin. A compound fracture is when fragments of the bone are perforating through the skin, kind of sticking out of the skin. Reduction is how we realign the bones so that bone tissue can heal. The open reduction happens when a bone is set via surgery. A closed reduction can involve manual manipulation on the surface of the body to be able to realign those bones. An open reduction, a surgical reduction, usually involves the placement of pins, screws, rods to help make sure that the bones or the bony fragments stay in alignment so that proper healing can occur. A closed reduction generally is just going to involve that manual manipulation followed by usually either a cast or a sling to keep the bones in place and in proper alignment during the process of healing. So the pictures that you're seeing are some common types of fractures. This Colles fracture that you're seeing is a common fracture of the radius of the wrist here. The radius is going to be thumb side. So you can see the thumb here. This bone right here is the radius. The other one is the ulna. This is a common fracture at the distal end of the radius due to a fall. Right? Oftentimes when you fall, you put your hands out to brace yourself, and that radius takes the brunt of the force there. That's a Colles fracture. A comminuted fracture can happen in any bone of the body, not just the femur as you're seeing here. But a comminuted fracture is when the bone breaks into more than two pieces. So you have little fragments of bone that kind of chipped away here. A compound fracture, as I mentioned, is when a bit of bone is perforating through the skin. Next up is a green stick fracture. A green stick fracture is kind of an incomplete, splintery fracture. It's often described as when you see a twig on the ground. You know how if you try to snap a green twig, a fresh twig, it doesn't snap in half very clearly or very completely, maybe just a part of it. And then if you tried to snap like a dry brown twig, it would snap completely in half. So green stick is that incomplete fracture. This is much more common in the bones of children. It can happen in any bone of the body, but in children too, it's also quite common in the clavicle, which is the bone that you're seeing here. That's also known as the collarbone. Green stick fractures happen more commonly in children because children's bone tends to have a higher concentration of collagen than adult bone does. Remember that 35 to 65% split of collagen to mineral in our adult bones. Well, in children, there tends to be a higher portion of collagen and a slightly lower portion of minerals. So children's bones are not quite as hard and they're much more flexible. An oblique fracture is any fracture in any long bone that's at an oblique angle through the diaphysis, at an oblique angle to the length of the bone. A transverse fracture is a transverse break right through the diaphysis, usually, of the long bone. A spiral fracture is a fracture of any long bone that occurs from usually a twisting or turning motion. Really common fracture of movement. So sports fractures or bone breaks that might occur during athletic performance, running, jumping, those kinds of things. Spiral fractures are also common from vehicle accidents, right? The body's in motion and gets twisted. Those kinds of fractures can occur. A pot fracture is a fracture of the fibula. So this is a common ankle fracture. Pot fractures are usually also going to occur when ligaments get damaged, destabilizing the joint, making these bone fractures a little more likely to occur. So what happens when a bone fracture happens? So of course, bone is vascular, so we get a hematoma. First of all, bleeding, right? And that bleeding is going to clot. A hematoma is a blood clot. So when bone first breaks, all that blood that gets broken and starts to spill out will end up clotting. All bone breaks are going to result in bleeding. It does not have to penetrate the surface of your skin. Remember that bone tissue is vascular, so these blood vessels are going to break. Even a hairline fracture will result in some bleeding. That blood clot forms, that's called the hematoma, but a blood clot is not very strong. So very, very quickly, the bone will begin to start to lay down as much collagen as it possibly can. Fibroblasts that are located in the periosteum and in the endosteum go quickly to work and they start to lay down collagen. Now, all that collagen is going to form something called a fibrocartilaginous callus. It's not really cartilage, but it really is a whole bunch of collagen fibers. Collagen is like your body's go-to super glue. It's going to try to heal anything it can with collagen, and that's the quickest thing that our body cells can make. Fibroblasts love to lay down collagen. So that collagen gets laid down first, but of course collagen is not very strong. So the soft callus is going to hold the bony surfaces together, which is why we want the soft callus to form with the bony surfaces in alignment. Then we're going to see a bony callus begins to happen. The collagen that was laid down in my soft callus will start to ossify. And the first bony callus that forms is going to be completely spongy bone. So we get all these osteoblasts building bone, building bone, building bone. And this does not look like the bone originally looked. This does not look like the diaphysis of a long bone. However, once my bony callus has formed, then bone remodeling will take place. And that bone remodeling will begin to build bone as the stress of bone use is experienced by this bone in our body. In fact, bone remodeling occurs throughout our entire lifetime as we use our bones. Your bones will get stronger where they experience more stress, and they will start to break down bone where it is not needed. So bone remodeling occurs with the combination of osteoblast activity, building new bone, and osteoclast activity, chewing up unnecessary bone. And so we'll see that this might take years to happen. Typically, like if you're wearing a cast, your cast will come off at the formation of your hard bony callus, and bone remodeling will continue to occur for months or even years as you continue to use the bone as you once did. Right? As soon as your cast comes off, your doctor is going to say, hey, don't go out and start running and jumping, don't do cartwheels, but do start to use your bones gently the way that you normally would. And that slow usage is going to start to build the strength that you need for that bone to return to its original strength and size. If you've ever had braces on your teeth, this is exactly what your braces do. Your braces are not changing the shape of your teeth. Your braces are placing pressures on the bony sockets that your teeth live in. The bony sockets in the maxilla and in the mandible, those alveolar processes, are going to shift their shapes based on the pressures, based on the push and the pull coming from those braces that are attached to your teeth. You're changing the shape of the tooth socket. You're changing the shape of the bony cavity. You're not changing the shape of the tooth by readjusting with braces. Okay, so disorders. Osteoporosis, that's the picture you're looking at down here. It's described as having porous bones. Bones with osteoporosis have generally decreased mass. Less calcium, less collagen makes these bones much more likely to break. They're very weak. So this is osteoporosis compared to normal, healthy, spongy bone on the right. Osteomalacia is demineralized bone. So without mineral, the bone becomes very flexible. And we start to see that bone softens and even bends in patients with osteomalacia. This is common with a vitamin D deficiency. Vitamin D is needed for calcium absorption from the small intestines, from your digestive tract. So you can eat as much calcium as you want, but if you don't have vitamin D around, you won't be able to effectively absorb enough calcium to maintain the integrity of your bone, the hardness of your bone that you need. If this occurs during childhood, as a child is developing, eventually the bone will ossify in a flexed position, right? As the weight of the body increases, particularly with the leg bones, that increased weight will result in the leg bones kind of bending and bowing because they're so flexible and they're not hard enough to support the weight of the body. When they do finally ossify, you get this ossification in a bent or bowed position. Sometimes that's referred to as bow-legged. Paget's disease happens when osteoclasts are way too active. When those osteoclasts are constantly chewing up bone, releasing tons of calcium into the bloodstream, there's tons of calcium in the bloodstream, and so osteoblasts are stimulated to build bone. And so we get this constant, rapid, almost like frantic chewing of bone and building of bone and chewing of bone, and we end up with these really abnormally formed bony deposits. It can be quite painful for patients with Paget's disease. Not only that, but the bone is definitely not as structurally supportive and sound as it should be because of the high rates of digestion that are occurring here too. And then osteosarcoma is our most common bone cancer. Bone cancer results when bone tissue begins to grow abnormally. And we tend to see these bony deposits and these bony tumors, not just remaining in the bone of the body, but also metastasizing to other organs of the body as well. So osteosarcoma is the name of that bone cancer.